Hello, my name is Ariane Buenrostro, and I will be reading the Professional English in Use Medicine chapters 5 to 13. Medical Practitioner 1. Practitioner. In Britain, doctor, also known as medical practitioner, must be qualified, have a university degree in medicine. They must also be registered, included in the General Medical Council list, or registered in order to practice. See Unit 13. They must, a doctor who treats patients as opposed to one who only does research is called a clinician. A doctor who provides primary care for patients is known as a general practitioner or family doctor. GPs usually work in a group practice. Larger group practice work in a building called a health center. Note: in British English, the verb is spelled practice and the noun is spelled practice. Part B. Specialties. Specialist doctor, for example, pediatricians, generally work in hospital. However, those who work outside the NHS, providing private healthcare, may have consulting rooms outside a hospital, for example, in the famous Harley Street in London. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians, respectively. In Britain, male surgeons are addressed as Mr. and females as Miss, so Dr. Smith is a physician and Mrs. Smith is a surgeon. A cardiologist specializes specializes diseases of the heart and circulation or cardiology. A geriatrician is a specialist in diseases of elderly patients or geriatrics. An anesthetist is a specialist in anesthetics. Note: names of specialties, usually in ology. Names of specialists, usually in ologies. If the name of a specialty and in X, the name of the specialist and in Asian. There are some exceptions, e.g., anesthetics, and anesthetist. Part C. Part C. Choosing a specialty. Jill Matthew has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I certainly prefer to work with children than say elderly patients. So I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialties like new neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I've assisted at operations several times, and I have even done some minor ops by myself. But surgeons have to be able to do the same thing out again, again, and again without getting bored, like tying of cord arteries and so on. I don't think that would be a problem for me, but they need to make decision fast, and I'm not too good at that. I like to have time to think, which means surgery. Surgery is probably not right for me. Note, note, the collocation good with is followed by a noun. Is good with children. The collocation good at is followed by the ing form of a verb or a noun. She's good at explaining procedure. She's good at explanations. Exercise. Write sentences to describe the work of the specialist in each branch of medicine. Look at the opposite to help you. 1. Dermatology. A dermatologist specializes diseases of the skin. 2. Rheumatology. A rheumatologist specializes in diseases of the joints. Traumatology. A traumatologist specializes in accident and emergency medicine. Pediatrics. Pediatrician specializes in diseases affecting children. Obstetrics. An obstetrician specializes in managing pregnancies. Complete the table with words from A, B, and C opposite and related forms. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Verb, noun, person, noun, activity, or things. Specialize, specialist, specialty. Practice, practitioner, practice. Consult, consultant, consultation. As, assist, assistant, assistance. Graduate, graduation. Qualify, qualification. Find preposition in the opposite that can be used to make word combination with the words in the box. Then use the correct forms of the words to complete the sentences. Good, interest, specialize, and work. 1. A pathologist specialize in diagnosis the disease through examining cell and tissue. 2. A pediatrician must enjoy working with children. An oncologist is interested in the diagnosis and treatment of cancer. A, fi a Fisher Street must be good. A psychiatrist must be good at counseling. 5. A neurosurgeon must be good with her hands. Make word combination using a word from each box. 2 words can be used twice. Look at A, B, and C opposite to help you. Consulting rooms. General practitioner. General practitioner. Group practice. Health center. Internal medicine. Surgical specialties. Over to you. Over to you. Reread what Dr. Jill Matthew said about surgeon in section C. Make a list of the qualities she thinks are needed to be a good surgeon. Then make a similar list of qualities for another specialty. If you are a student which branch of medicine do you think you have the qualities for? If you have already completed your training, why did you choose your particular branch of medicines? Qualities, qualities, Dr. Jill Matthew says a good surgeon needs good with the hands, manual dexterity, able to do the same task repeatedly without getting bored, able to make decisions quickly, decisiveness. Qualities need for another specialty, pediatrics. Good with children and able to relate to them easily. Patient and understanding. 3. Able to explain things clearly and simply to both children and parents. 4. Observant and thorough since children may not describe the symptoms well. 5. Empathetic and able to inspire trust. Answer to the other question. I'm a fourth semester medical student. I believe my qualities fit well in the field of neonatology because I'm patient, compassionate, and attentive to detail. I also enjoy supporting families and believe I can communicate with the empathetically. Thank you.